Come in.
Hi, my name is Mackenzie. I'll be your student nurse today.
Hi, Mackenzie.
All right, I'm going to provide us with privacy, wash my hands, vitals have already been done. Can I see your wristband? And what's your name and date of birth?
Matthew McMahon, 12/2/83.
Okay. Today we're going to do a head-to-toe assessment. It's pretty much as it sounds. We're going to assess the body systems from head to toe, be sure everything is working and functioning properly.
Sounds good.
Are you comfortable?
I am.
Okay, so do you know who the president is?
Donald Trump,
And do you know where you are?
Ocala, Florida.
And do you know the day of the week?
Wednesday.
Patient is alert and oriented ×3. Quality and appropriateness of speech is within normal limits. Hygiene is within normal limits. And posture is relaxed. So first we're going to start off with the head, ears, eyes, nose, and throat. So I'm going to inspect your head for any lesions, bumps, parasites, and hair distribution, which I see no abnormalities noted. Now I'm going to inspect your face. So I'm going to touch your face, and I just want you to let me know where you feel the sensation.
Okay.
So if you could close your eyes.
Forehead, left cheek, right cheek, chin.
Okay. And you can open your eyes. Can you lift your eyebrows for me? And can you squint? Can you puff out your cheeks? And can you smile? All right, cranial nerves 5 and 7 are intact with no abnormalities noted. So now I'm going to check out your eyes. First, I'm going to inspect for any redness or discharge. In the right eye, I see none. Left eye, I see none. So now we're going to check out your pupils. If you could just follow, stare straight ahead. All right. All right, pupils went from a 4 to a 2. So I want you to follow my pen with just your eyes only. All right. Perfect. Cranial nerves 3, 4, and 6 are intact with no abnormalities noted. Can you stand up for me and cover one eye? All right, and let me know when you can see my fingers, okay?
Now. Now. Now.
All right, other eye. Same thing.
Now. Now. Now.
Okay, you can sit back down. Cranial nerve 2 is intact with no abnormalities noted. So now I'm going to check your mouth. If you could open your mouth. Mucous membranes are pink and moist. Tongue is memline. Dentition is good. Can you stick out your tongue and say ah? Okay. Uvula is midline. Can you move it side to side? Okay. Cranial nerves 9, 10, and 12 are intact. No abnormalities noted. Now I'm going to check your nose. If you could tilt your head back. I'm going to check for any drainage. There's no drainage. Septum is midline, and there are no deviations. Can you cover, I'm going to check for nasal patency. Can you cover one nostril, breathe in and out? Other side. All right, no abnormalities noted. Now I'm going to check your ears for symmetry first. Ears are symmetrical. Check the right ear for any redness, extra cerumen or drainage, and I'm gonna check for tenderness. Do you feel any tenderness?
No.
Okay. Same thing on the other side. All right. And can you close your eyes for me, and let me know when you hear a sound? Okay.
Left side. Right side.
Cranial nerve 8 is intact with no abnormalities noted. You can open your eyes. So now can you push against my hands? All right, and push your face against my hands. Perfect. Cranial nerve 11 is intact, no abnormalities noted. Now I'm going to palpate your lymph nodes. Let me know if you feel any pain or tenderness.
Okay.
Submental, submandibular, tonsillar, preauricular, postauricular, occipital, posterior cervical, anterior cervical, and the supraclavicular. All lymph nodes are mobile and non-tender, no abnormalities noted. Now I'm going to inspect your thorax. So thorax to AP to lateral is 1 to 2. Breath is labored and even. No use of accessory muscles. No abnormalities noted. Now I'm going to check your spinal alignment. If you could turn this way for me. Okay, you could give yourself a bear hug. I'm checking the spinal alignment. No abnormalities noted. Now you can stop giving yourself a bear hug. I'm gonna check for costovertebral tenderness. So just let me know if you feel any pain.
No. No.
Okay, and if you could give yourself a bear hug one more time, I'm gonna check for thoracic expansion. Go ahead and do a deep breath in and out. No abnormalities noted. And now I'm going to inspect for tactile fremitus. So I'm going to use the ulnar side of my hands, and I'm going to move my hands 3 times, and each time if you could say 99.
99. 99. 99.
Okay, equal vibrations on both sides, no abnormalities noted. Now we are going to listen for breath sounds. So I'm going to start on the posterior. So every time you feel my stethoscope move, just take a deep breath, okay?
Mm-hmm.
No abnormalities noted. Now we're going to do the anterior side, same thing. Deep breath. No abnormalities noted. Now I'm going to listen for your heart sounds. So we're going to start with the aortic, which is at the second intercostal space, right sternal border. The pulmonic, which is at the second intercostal space, left sternal border. Erb's point, which is third intercostal space, left sternal border. The tricuspid, which is the fourth intercostal space, left sternal border, and the mitral, which is the fifth intercostal space, mid-clavicular line. No abnormalities noted. You can turn back around this way. Now I'm going to inspect your abdomen, so you can go ahead and lay back for me. Abdomen is flat and non-distended. First I'm going to auscultate for bowel sounds. So I'm starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to palpate the abdomen for any masses or tenderness. If you feel any tenderness, please let me know.
Mm-hmm.
Right lower quadrant,
No.
right upper quadrant, left upper quadrant, left lower quadrant. You can sit up.
Thank you.
When was your last bowel movement
This morning,
and your last urination?
a couple hours ago?
And are you feeling any pain or burning when you urinate?
No.
Okay, so now I'm going to inspect and palpate the skin. Let me know if you feel any tenderness.
Okay.
I'm checking for edema, lesions. So I'm going to start here. Skin is warm and dry, no edema, no lesions. Alright. Now I'm going to capillary refills. So less than 2 seconds and less than 2 seconds on the big toe. Now we're gonna check for gait and balance. So if you could stand up slowly for me.
Thank you.
Okay, and take 3 steps towards me. And 3 steps back. Okay, and if you could roll your head for me. And do circles with your arms. And do one leg at a time in circles. Okay, and now if you could put your arms at your side and close your eyes. I'm checking for any swaying. No swaying, so Romberg is negative and no abnormalities noted. You can open your eyes now. You can go ahead and sit back down. Now we're gonna do the deep tendon reflexes. So first we're gonna do the triceps. Just go ahead and loosen your arm. Okay. All right. And now biceps. Okay. Brachioradialis. The patellar. And the Achilles. Now we're going to do the plantar, which is negative Babinski. So no abnormalities noted on either side. And now I'm going to check your pulses. So we're going to start with the brachial. And the radial, and the popliteal, posterior tibial, and the dorsalis pedis. All pulses are equal bilaterally, no abnormalities noted. So that concludes our assessment. Are you comfortable?
Yeah.
Is there anything else I can get for you? Okay, I'm going to wash my hands and I'm going to go document my findings, and here's your call light if you need anything else.
Thank you.
Thank you.